An uncontrolled BP in pregnancy can actually make you to lose that pregnancy, and it can also put your life at risk. Welcome back to CSA series. Today's topic is preeclampsia. But before we get into it, let's talk about how BP could lead to that. Normally, pregnancy shouldn't come with a dangerously high BP, but when it does, it can lead to a condition called preeclampsia. This condition doesn't just affect the mother, it also affects the baby. Let me explain why. The role of the placenta is to provide oxygen and nutrients to the baby. It's also responsible for the removal of waste products. Just so you know, the normal range should be between 100 to 120 systolic and 60 to 80 diastolic. So anything around there is fine, but anything above that is giving a signal of hypertension. So when we say dangerously high BP, it means if your BP is above 140 systolic, that can be actually dangerous. So when the BP is high in pregnancy, it narrows the mother's blood vessels, and this decreases the blood flow to the placenta. Once the blood flow to the placenta is decreased, the oxygen and nutrients that the placenta is supposed to transfer to the child is also decreased. And once that happens, what will happen to the baby? No oxygen, no nutrients. The baby would stop growing gradually, and this can eventually lead to stillbirth. So, what is preeclampsia? Preeclampsia is when the patient has extremely high BP in pregnancy with the presence of proteins in the urine. That presence of proteins in the urine is telling us that your kidney is beginning to have issues. This preeclampsia can come with severe headache, blurry vision, weakness. In some complicated cases, it can even lead to seizures. And the only way to actually manage this case when it gets to that point of seizures is to actually deliver the baby. So please and please do not skip your antenatal visits. Regularly monitor your BP by yourself. You can have your own BP machine at home to monitor your BP. And if you've actually been diagnosed with high BP in pregnancy, do not skip your medications. Use your medications. I'm saying this because I've had patients who say that, oh, don't worry, my pastor said everything is going to be all right. I do not have BP. Some would even be in denial, telling you, I will never have BP over my dead body. It is not in my destiny. And at the end of the day, they end up losing the child and even putting their life at risk. I'm not saying miracle doesn't exist. Miracle exists, but please still listen to your doctor and take precautions when necessary. Heaven help those who help themselves, isn't it? If this video was helpful to you, don't forget to like, follow, and share to anyone who is pregnant that you know. See you in my next video. Bye.